Yeah. So thank you, Chairperson sir. Thank you, Team BDCon, for inviting me for this very pertinent topic. So after two back-to-back core endocrine topic, my job is relatively easier, but again, it's very important for our day-to-day clinical practice. So before I start, may I have a raise of hand? How many of you routinely advise vaccination for your diabetic patient? 3, 4, 9, 10. Semi-routinely. Okay, that should be the correct term. Okay, so a lot of hands. So I think it is very important to know the updated guideline for the same. So in this realm of comprehensive diabetes management, holistic management, vaccination is again a small part in the whole diabetic management. And it has gotten momentum after the COVID-19 vaccination. People know what vaccination is. They know how it can change the clinical course. The two main important aspects why we vaccinate is number one, prevention of an infection. And number two, even if we cannot prevent it, the severity is reduced. Let's say somebody who has gotten influenza vaccination, he may not be totally immune to the influenza, but the severity of infection, the hospitalization comes down. In this perspective, I found two guidelines recently published. One is 2024 in India, both are from India, and another is 2025. So for next 10-15 minutes or so, I will be discussing all the data that I found from these guidelines. Obviously, we have guidelines from ADA, which I'll show later, but possibly the Indians are more pertinent to us. Now, before I start the individual vaccines, let me explain the types of vaccine. One is a live attenuated vaccine where the antigenicity is reduced, but immunogenicity is maintained. Another is a conjugate vaccine when a portion, a particle point of whole virus or whole bacteria is given against which immunity is developed. Obviously, live attenuated vaccine have less antigenicity, but not 100% foolproof. That is why it cannot be given to pregnant mothers or those who have less immunity power. However, conjugate vaccine is relatively safer. It cannot cause the disease itself. Now, why diabetes is special mention? Because all of us know diabetes is an immunocompromised state, especially if it is uncontrolled. But it has been shown your diabetes, if it is moderate, it is controlled, they have adequate immune response to vaccination. So their immunogenic power is at par with those without diabetes. But there are some theoretical concern whether in uncontrolled diabetes where the immunity power is low, the vaccines do have similar immunogenicity or not, but the guidelines are not very clear that at what A1C level we can advocate vaccine. But to our clinical experience, we usually do not prescribe it to a patient with HbA1c of 12. After reasonable control, then only vaccine should be administered. So I'll be discussing 6 important vaccines today and 1-2 more vaccine that's for theoretical concern. One is pneumococcal, then is influenza, hepatitis B vaccine, Tdap vaccine, zoster and COVID. Let me start with the pneumococcal vaccine. So there are 2 types of pneumococcal vaccine. Pneumococcus is a bacteria, right? So pneumococcal polysaccharide vaccine or PPSV is the first one. This PPSV is against 23 strains. So it is also called a PPSV 23 vaccine. Another is a conjugate vaccine. It has a polysaccharide conjugated to a carrier protein that enhances the antibody response. More antibody production is there, but it covers only 13 strains. So we have PPSV 23, more strains, less immune response. We have PCV 13, lesser strain, but greater immune response. In between, there is PCV 15, which is yet to come in India. That is possibly going to be the best vaccine, but we do not have it in our hand. Now, how effective is a pneumococcal vaccine? It has been shown, as I previously mentioned, it reduces the hospitalization risk as well as the total death, and that's why the systemic reviews do recommend it should be given. Now, when I asked everyone that how many of you routinely prescribe, I saw at least 30% in this hall raise their hand. But if you see the worldwide data, except from the Western few countries, the whole world is not doing so. Even we have our own data, and that is also less than 1% people are getting pneumonia vaccine in diabetes. So we are missing opportunity And the main reason is behind that is in the recommendation in routine care, most of the diabetic guidelines do not advocate vaccine properly, right? So these are the ADA guideline. Let me focus the Indian one. So Indian guidelines, they do recommend. We have two vaccine, as I said. One is PPSV 23. I've written the trade name as well because that's the only vaccine available now. There is Pneumovax 23 and we have Prevnar 13. So for the age group of 19 to 64 year, we need to give mostly PPSV. However, if PCV 13 is taken, then you can give a PPSV 23 at least 1 year after that. But for those who are more than 65 years of age, we need to give both the vaccine. First PCV 13, we need to build up more immune response. After 1 year, we can give a PPSV 23 to improve the strain number. And do these vaccines need a booster dose? Yes, if your age is above 65, you can revaccinate after 5 years. But it's not clear below 65 year. Possibly we do not need, but once the patient you have given at age of 50 now crosses 65, it's better you give a PPSV 23 at that time, right? So these are the two vaccines, Prevnar 13 and Pneumovax 23 that are currently available in India. Coming to the influenza vaccine. Influenza is a virus, right? So it can affect the same individual repeatedly, and the major mechanism behind that, it changes itself very frequently. The antigenic shift and drift, they go rapid evolution, and that's why it evades the immune response of an individual. So that's why you can have influenza 3 times, 4 times in a year, and year after year you can have influenza. So that's why there are a lot of strains actually, and all the strains changes frequently. So here this vaccination, what is important, yearly updated influenza vaccine. So the vaccine we advocated in the year of 2023 will not be the same that we will prescribing in the year 2025. And that's why again, there are two type of vaccines, live attenuated and inactivated. Live attenuated is not recommended for diabetic patient because it still contains some antigenicity, right? So the current available today, it is Influvac Tetra, and it has shown 2024, 2025. The name they have given this. Last year, it was Influvac Tetra 2024. So this year the vaccine changed because they are changing the strains that are included in this vaccine. This vaccine has reduced the risk or hospital visit by 40 to 60%. And what's the recommendation? That any person who is 6 months or older can get an annual vaccination, influenza vaccination. And it's relatively cheaper than the pneumonia vaccination, and it can actually help, especially in diabetic individual, for less hospitalization. So yes, influenza vaccination yearly.